Hello everyone, my name is Emily French. Thanks for the intro, Belinda. So as she said, I currently look after our high support clients, so those with high cervical spine injuries who are on ventilators. And in my spare time I do a bit of continence and wound management. So Belinda's asked me here today so I can talk about pressure areas, and I'm also going to go through some of the dressings we traditionally use when wounds break down. I think that's something that many people in the room would have experienced before, and maybe different dressings can be a bit confusing. There seems to be so many out there on the market. I'd like to start off just by asking who's had a pressure area here in the wound. Yep. And does that, did that impact on your quality of life?
Massive.
Did that take a while to heal?
A year and a half, and 4 months in bed was stage 3.
Yep. So just imagining 4 months in bed to keep off that area is just huge. So today I wanted to really talk about pressure areas because it is top of mind for spinal injuries patients. So we've seen the lovely Belinda. Okay, so this all makes sense. You're either in your bed or you're in your chair, and all of these areas is where you're going to have bony prominences against a hard surface. So tailbone, hip. This is the chap that Belinda was talking about, one on each side. A wound the size of a fist down to bone. That is really difficult to heal. And then of course your heels. So that's just sitting up. So this path is fraught with danger. So what is a pressure ulcer? So it's basically damage to the superficial skin and the skin just underneath. And it usually occurs over a bony prominence. So for example, your heel is an excellent example, or your ITs are an excellent example. So they can be quite blind, like sometimes they won't reveal themselves. And they range in severity from skin discoloration through to just a superficial breakdown of the skin, down to muscle and bone, and that's when you're starting to you're going to have to start bringing out your big guns for that. So again, the other places you'll see when you're lying down is the back of your head and your ears, shoulders, elbow, buttocks. Saw a chap the other day, very malnourished, and had a huge big wound on the inner knee, and then of course your heels again. And again, it could be any position that you're lying in, so whether it's supine, on your side, in your chair, sitting up, pressure can occur at any one of these areas. Does that make sense? Okay, so basically the pressure from a mattress when you're lying down compresses the skin and tissue, and what this does is compress the capilliaries. So that means that the oxygen carrying capacity to the wound has been eliminated because they've been squashed. So that's when you start getting your pink discoloration, and if it's left, then it will start to break down further. So here's an example of what could happen, and this isn't so dissimilar from the wound that we were talking about from this gentleman. So here we've applied negative pressure wound therapy, which I will describe in more detail a bit later, but you can see the circumference and depth of that wound is quite different to this one here. Now if you were to whack a band-aid on that, you're not going to get that outcome, are you? So that's when you really got to start with your big vacuum therapy dressings. Okay, so we've all heard of the word shear. Who uses a slide sheet at home? Okay, yep, some people do. Some people just have their carers or the nurses in hospital reef them up the bed, and they don't understand why that's an issue. You know, it's so much easier just to do that rather than tuck a slide sheet underneath and then slide them up the bed. What basically happens is that your skin is going in different parallel forces like this. So it literally breaks the surface of the skin or what's going on underneath the skin. And that's when you start getting this kind of breakdown. That also could be, to me, you know, someone who's had continence issues and the urine or the fecal matter is breaking down the skin. It could also be a shear injury. So does everyone understand what shear is? No. So for example, if you were getting dragged up the bed and your heels, you were just, you know, lying on your sheet and your skin is fragile on the back of your heels because it's over a bony prominence. If you are pulled up the bed, your skin's going this way and the sheet's going this way, and that's when it literally rips it. Okay?
The forces are going into place.
Okay, so we're going to look at this acronym called SKIN. So S is for support the surface. Now we all know about the benefits of a pressure reducing foam mattress. This particular gentleman that Belinda described was in hospital and the nursing staff had forgotten to put his pressure relieving mattress on. So he lay on his, on his back without the pressure relieving mattress on for something like 12 hours, and by that stage it escalated to the wound that it is today. So that's why pressure reducing devices, which is Belinda's area totally, are so completely important, and as are your Roho cushions, for example. So if you were just sitting in your chair on just steel, you'd have a different story today. So keep on moving. Difficult for some of you to keep on moving considering your positions, but basically lying or sitting in one position for long periods of time causes the skin to become damaged because you haven't got that oxygen carrying capacity because the capillaries are crushed. So the blood vessels going to the wound are not giving it nutrients to heal because they have been crushed. So the client should be repositioned regularly. So for example, at home, some of your carers might put you on your side and then pull the pillows out and put you on your other side. It's basically pressure area care to prevent these pressure areas from occurring. Does that sound fair enough? Okay, incontinence is a huge problem because, as you know, urine and feces, just anything wet, forget about the fact that it's acidic and everything else as well. It's wet, you're lying in it for a long period of time, your skin's going to break down. So that's why we've got to be so vigilant about our continence. So your carers need to be inspecting, if you can't do it yourself, what's going on in your peri area regularly. Okay, so nutrition and hydration. So the skin, the integumentary system, is the largest organ in the body and it needs to be kept really well hydrated. So at least 2 litres of water a day, and at the moment when it's cool, although there's been a bit of a cool change, I'd recommend just getting stuck into the water. Okay. I'm not going to get into the nitty-gritty about all the different stages, but you'll start off with something like, and that's a fairly severe stage 1. So, for example, just a very reddened, it almost looks a bit like a nappy rash. So that could be from incontinence, or that could be from shear, or that could be from lying in the same area for too long. All of the above can occur. Okay, and then we go down to your stage 4s, which is down to your muscle, tendon, bone, and that's pretty serious. Somewhere up here, you might need to get it debrided, and what I mean by that is they actually cut out the dead tissue, because a wound cannot heal with dead tissue in it. You can't just cover that up and wait for that to heal. That does not occur. So you need to prepare the wound bed first, and that means you need to get all of the dead material away. And you might hear people talk about slough. You might hear people talk about necrotic tissue. That is non-viable tissue, and that tissue needs to be removed before you heal. Okay? This is similar, a similar kind of wound to the chap we're talking about. So basically this is unstageable. You can't see what's going, if you're looking at that, you have no idea where that's tracking to. That needs to be debrided, so I would say you would need to put some hydrogel on that, and then you would need to actually cut the top off and have a look what's going on underneath. Sometimes that means they need to go to theatre for that. Sometimes it's not all about a wound nurse or a nurse or a carer. Sometimes they need to go to plastic surgeons or vascular surgeons for these kind of things. So that's why it is so important just to keep a very vigilant eye on pressure areas so they don't go rogue and end up like this. Okay, so this is just a really simple way to remember it. So it says time, T-I-M-E. So T, tissue. So what we're talking about here is non-viable tissue. Like I just said, non-viable tissue is a sloughy wound. So something that looks like yellow, pussy kind of stuff, that's dead. We need to get rid of that. Another non-viable tissue would be necrosis, a necrotic plug. So what colour is that? Black. And what happens with people with frostbite and they have black fingertips? They're not real healthy. They're not coming back anytime soon. So your black plugs in a wound are bad. They're dead. They need to go one way or another. There are different ways you can do that. You can cut them out, and that would normally be a doctor's role. Or you could use something like Solicite. It's a gel. So basically it's called autolytic debridement. So you would pop that on over your heel, for example, if it was your heel that was necrotic. And then I might put a piece of film over the top just to speed up that process. And then you can actually, you know, if it's superficial enough, you can actually then get rid of that necrotic plug or that sloughy tissue. So that's called autolytic debridement. Sharp debridement, autolytic debridement. Okay, so then we have infection or inflammation. How do we know that a wound is looking a bit crook? How do we know that it is looking infected? Hot. Yep. Smells. Yeah, there's lots of wound ooze coming out of it, so it's nasty wound ooze coming out of it. It might be like some pussy looking stuff, white blood cells coming out of it. It might be swollen, might hurt, burning. You might have a temperature. So all of those things, and you know, like a really nasty one, you might start seeing, if you had a wound on your hand, you might start seeing something resembling wildfire crawling up your arm, you know. So that's cellulitis in its extreme form, and it's just spreading up your arm. Now that's a nasty bug, and you've got to get to hospital and on antibiotics really quickly. So wounds can kill. Wounds are serious business. Okay, so there's a difference between infection and inflammation, but both need to be treated with a healthy respect. So a moisture imbalance. What I mean by that is the exudate, which this gentleman talked about over there. Exudate is just a word for wound ooze. So if there's too much wound ooze, it means there is something called maceration. So that's what happens, and it just the edges of the wound become white. It breaks down the skin. It's basically drowning the skin. And then the other one is when it's very dry. Okay, and you know, like basically one of those wounds on the heels that is very dry and you can't see what's underneath it. So it's like a scab. It's called eschar. So either way, they're both unhealthy. Too much fluid, too little fluid is not good. We need to have a healthy balance. And then the old wound edge, is it advancing or not advancing? Is it getting smaller? Is it getting bigger? Why do we measure wounds? We're measuring wounds so we can see, is the surface area of the wound actually reducing? Is what we're doing working, or is it actually getting bigger? So it is definitive information that you can pass on to a doctor and say, this wound has increased 50% in size in the last month. What are we going to do about it? Okay, so now I'm going to go on to the actual dressings part of the talk. So we were talking about autolytic debridement, where we're putting on the gel and then we're putting on a piece of film like an IV dressing to speed up the process, and then you'd go back in an hour or so, you'd take it off, and that would loosen everything up. Okay, and then you'd irrigate that out with some saline. So Solicite looks a little bit different to that packaging. It's basically gel. It's also something you could use for sunburn or any kind of burn, that kind of thing. Has anyone used anything like that before? Yep. So like I said, it's donating moisture. It's adding moisture to the wound, which rehydrates that necrotic tissue and sloughy tissue so we can get it out of there. Foam dressings. Now Sam is going to be lovely enough to walk these around for me, or Belinda, you can go that way. Now what I've got here is some samples of some of the most common wound dressings out there, so that you can have a bit of a closer look. Have a look on the side of them as well. You'll see that their contact layer to where it would adhere to your skin, they're all different. Okay, so what is this Mepilex? People talk about Mepilex all the time. Why Mepilex? That's Mepilex. So these are all advanced wound dressings. These dressings are not designed to be taken off every day unless there's a good reason. Okay, these are meant to stay on for up to a week if your wound can handle it. All right, we don't want to be taking wound dressings on and off, on and off, on and off. That's old school. Who's heard of people talking about, oh, we'll just change the dressing every day and go and stick it in the sun and that'll fix it? No. You need to keep a nice wound balance with a product that you can keep it sealed off from the environment, and they can last up to 7 days. Now what does that do for you guys outside of horrible dressing changes? Means you're saving money, because one of these is about $8 to $10. Yep. And you can leave that on for a week. So if you can, do it. So it actually has a silicone contact layer. Why is that important? Why do you want something that's gentle to adhere to your wound? Less friction and less pain. And it's also not going to rip off all that new healthy skin growing. So the new skin is granulating and it's growing, and it's, you know, you're trying to replace, you know, where you've debrided that skin. But if you put on a piece of tape, for example, Imagine if I put that on over the top of a brand new wound. What's it going to do? It's going to rip it off. It's going to rip off all that good skin and possibly tear the other good skin. So that's why silicon's good. If you hear people talking about silicone, that's the reason. It also has a bit of foam in it, which means it can handle a bit of exudate. Not a huge amount. If it's gushing out, then it's not an appropriate dressing. Allevyn Adhesive. So this is a foam dressing. This is coming in a lot of different shapes and sizes. That's a sacral dressing. That's just a little one. It's another one. So Allevyn Adhesive has a very particular skill, and that is that this top layer of film breathes. So it's got something called a high moisture vapor transmission rate, and that means as your exudate is passing into the dressing, it can kind of evaporate through that film. So it's a very smart dressing, and it can handle a lot more exudate than the Mepilex. So you would use a Mepilex for something like a skin tear. If you had a wound that was more chronic and had more stuff coming out of it, I'd probably go for an Allevyn. Silver dressings. Who's heard of silver? It's a bit of a buzzword. You hear people talking about silver band-aids. Don't buy the silver band-aids. Useless. They do not have an effective amount of silver coming out of them to do anything. So there are a lot of different silver dressings on the market. They are expensive. Some of them deliver silver in different ways, and the silver is in different forms. There's something like nanocrystalline silver, which is like the Acticoat, which is used for burns dressings. So the big Bali bombings that happened, these clients were covered in Acticoat. There are other kinds of dressings as well. You'll hear about Mepilex AG, you'll hear about Allevyn AG. Anything with AG on the end is a silver dressing. Okay? Be careful with which silver dressing you choose to use, because some of them will just be not giving you an effective amount of silver, and therefore you're paying all this money, but you're not actually utilising the silver's best abilities. Okay, so
What do you recommend?
top of the range silver dressing is Acticoat, without a doubt. So it comes, and it was on that sheet that I passed around. It's like a material. That material needs to be activated by moisture, whether it's just some water or it's the wound ooze. And what that does is release the silver onto the wound bed, which kills like over 100 different microorganisms which are toxic. So this is the gear that they use for burns. If I had a big nasty wound, I'd use Acticoat. Okay, I put this one in because people talk about Comfeel and Duoderm all the time. Why would you use these dressings? These dressings don't have a particularly high ability to soak up moisture, but they do have their place. Like for example, if you were wanting to put on a shoe and you wanted to protect the back of your heel because you get blisters, something like Comfeel would be good. They also use these kind of dressings over the top of, like for example, a cesarean wound, where they can look through and they can see the suture line. So they do have their place, but probably not as much, except for maybe pressure relieving from your perspective. Okay, so this is the really exciting stuff. I'm passionate about this. So we've got two. What I'll do is just go to the next one first. I'm going to explain the principles of negative pressure wound therapy. So basically, if you have an extensive wound or a very deep wound, and whacking a dressing like this on top is not going to do anything, and you can understand why it wouldn't do anything. If I put that over the top of something like this, what's it doing? nothing. Covering it up so you can't see it. So basically, what is it? Negative pressure wound therapy has been around since time began. Have you all heard of the cupping techniques that the Egyptians used to bring oxygen to the surface of the skin? And you can actually see that they've been cupping. So that is a form of negative pressure wound therapy. It's been around forever. These days, it's an amazing tool that can save lives. So you can either have it attached to a big hospital grade pump if you need a bit more grunt, or something like this one here, which is a disposable negative pressure wound therapy pump. This is an example. It comes in different sizes, etc. That is a battery. So basically, you turn it on and it creates a vacuum. And as you can see, it's kind of shriveled like a sultana. That means that it's under pressure. It's all under pressure. That would have taken a lot of work to do. Okay, so basically what does it do? Like, what's the benefit of having this machine sucking ooze out of a wound? So it stimulates the tissue formation of new granulating tissue. Granulating tissue being positive, good tissue. Okay? It continuously wicks away removal of exudate into this canister here. So you're reducing your bacterial burden. Okay? It's also closing, physically closing the wound. So a lot of times these are actually put on in theatre. Like they might do, say for example, that there's an infected hip operation and they've had to take out the hip. They might put in something like negative pressure wound therapy as a adjunct until they go on to the next phase of healing that wound. As you can see, it can be put in all different places, weird and wonderful places, and wound nurses are very inventive about how they achieve a seal for these wounds. Can you imagine that is difficult to try and engineer?
What is it, Emily?
That's between, what we're looking at here, I believe, is a male or female peri area. Yeah, so I would say that something's occurred here, like cancer or something, and basically they've packed it full of foam, covered it up with a film, and then turned the machine on, and then it's sucked down like that. So you'll see some people in hospital who literally have like 2 or 3 of these machines over them because they've had big burns or something. Okay, does everyone kind of understand the principles from looking at that? So that's me and my talk about wound dressings. That's my part of the presentation over.